All right, let's get started. Hello, everyone, and welcome to Ship's Health Hour. We're so glad that you're here for today's live discussion on the Athlete's Longevity Blueprint, training smart at any age, preventing injury, and improving recovery. We'll begin with a 45-minute discussion led by Dr. Eda Akyar, and then we'll open it up for a live Q&A. You can submit your questions anonymously in the Q&A forum at any time, so feel free to share them throughout the session. Before we get started, a quick reminder that the information presented today is for educational purposes only and does not constitute medical advice. Nothing in this presentation is intended to diagnose, treat, cure, or prevent any disease. Please consult a qualified healthcare professional regarding any medical conditions or treatment. Dr. Akyar, I'll turn it over to you.
Hey, thank you, Solly, and welcome everyone. I'm Dr. Eda Akyar, and I'm very excited to talk to you about this topic. Before we dive into the presentation, just a brief background on my educational background. I attended Carnegie Mellon University for my undergraduate studies in biology and chemistry. I then went to Yale for my master's of public health before coming to Loyola University Chicago for my medical school training at Stritch School of Medicine. I returned to the East Coast, which is where I'm from, to attend my family medicine residency at New York Presbyterian Columbia University, and then came back to Chicago for my primary care sports medicine fellowship at Midwest Orthopedics at Rush. Right after that, I joined Shift, and I'm very excited to get into this presentation. So before diving in, just a brief roadmap. We'll first explore the importance of exercise. We'll talk about the physiology of aging, and then what are some of the things we can do to help train for longevity. We'll spend some time talking about improving recovery, and then go through how to train through the decades. We'll finish the presentation with a little bit of presentation on preventing common injuries. All right, so let's get started. First, with the importance of exercise. So exercise is not just about fitness. I know many people are focused on reducing adipose or fat tissue and building skeletal muscle, but exercise is really for the whole body. It is medicine for the whole body. It offers benefits to virtually every organ system in the body, including the immune system, the nervous system, and the cardiovascular system. Some of the cardiovascular benefits that we can see that come from exercise include reducing blood pressure and improving our cholesterol numbers. Metabolically, exercise can help improve insulin resistance, or insulin sensitivity, and glycemic control, reducing your risk of developing diabetes. And of course, many of us can attest to the positive benefits to exercise to our mental and emotional health. There is strong evidence that shows that exercise reduces the risk of depression and anxiety, improves sleep, and enhances cognitive function. So altogether, we can see that exercise is extremely important in thwarting chronic disease and can ultimately improve your longevity and health span. Guidelines currently call for 150 minutes of moderate intensity exercise, and when someone achieves this, you can reduce your all-cause mortality by 33%. So there certainly is a tremendous benefit of exercise. So what gets in the way of exercise? Far too often, exercise is the first thing to fall off the priority list, unfortunately, when life gets busy. Many of our patients will report busy schedules, long days at work, and family responsibilities as the primary reason why they can't get some time in for purposeful exercise or physical activity. In place of exercise, this often means we're spending more hours sitting. And so while we can't change the variable of time and how our body changes as we age, it is important to understand what happens when we're not moving our body. So as society becomes more sedentary, I'd like to spend a few more moments just diving into the topic of what happens when we sit. So is sitting the new smoking? I know many of you may have heard this statement, and while it's not a literal comparison, as smoking is much more dangerous than sitting, the metaphor certainly does carry weight. As our society has shifted into a more sedentary lifestyle, with adults averaging about 8 hours a day sitting, we do see chronic disease on the rise. So what exactly is happening to your body as you're sitting? Sitting prevents that contraction of large postural muscles. So think the deep abdominal muscles, your obliques that help with core stability, the muscles around the spine that help keep your body upright, and then the gluteus and the hip flexors that help balance your pelvis. These are all important skeletal muscles, which do serve as primary sites for insulin-mediated glucose disposal. So when you lack contraction, you're not getting that glucose disposal as much as you would if you were. Therefore, we do see a result of increased postprandial or post-meal glucose and an increase in insulin demand, altogether increasing your risk for developing insulin resistance. Additionally, excess sedentary time can also promote visceral fat storage deep in the abdominal cavity. So this is the fat that surrounds your core organs, as well as loss of muscle mass and strength, a decrease in bone density, and then just an overall reduction in cardiorespiratory fitness. So altogether, these risks show us that a sedentary lifestyle cannot be ignored. Unfortunately, exercise is not the antidote to sitting, as long periods of sedentary time are associated with health risks, even among those who are exercising. Therefore, we want to stress the importance of doing both exercise and breaking those long periods of sitting. So we want to encourage you to make sure that you're adding some daily exercise and daily movement. And so what are some strategies that we can do to help increase movement? Some ideas include getting up after long periods of sitting, parking your car farther away from an entrance so you get a few extra steps in, taking the stairs, standing throughout the day. A standing desk is an excellent idea. Stretching while stretching, standing, and walking while you watch TV can also help add in a few more exercise or a few more moments to break up those sedentary periods. And then walking after eating. And this last one, walking after eating for about 10 to 15 minutes, is especially appealing as it can help blunt those postprandial spikes in glucose. Another important fact here is that there's no set frequency or duration that really helps you say, okay, after I've sat for an hour, I need to get up and move for 10 minutes. The key here is frequently interrupting those prolonged periods of time. So again, exercise should be your planned dose of physical activity, and movement should be the rest of your day. You need to make sure you're optimizing both. Next, we'll move into aging and exercise. So we'll dive into a little bit more on how the body changes, specifically how the musculoskeletal tissue changes as we age. Starting with muscle, we see sarcopenia starting at about age 30 to 40. Sarcopenia is defined as muscle mass, the decline of muscle mass through the ages, and it can continue at a rate of 3 to 8% per decade. At the age of 60, we can see this accelerate, and we can really see this in the diagram that is to the right of the PowerPoint slide. Here we have a cross-section of a thigh or upper leg that shows us the main muscle here, the quadricep, as well as the hamstrings, and how at the age of 35, we have a full set of muscle, but 30 years later, we can see that there is a decline in the muscle and perhaps an increase in adipose tissue or fat. And then by the age of 85, an even greater loss of muscle mass. Another important point here is that strength is closely related to muscle mass. And so therefore, when we're losing muscle mass, we are also losing some strength. We also see some changes to our tendons and ligaments. As we age, that ability for collagen to turn over, which is the process by which the body is breaking down old protein and building new protein, slows down. This turnover is really important to help the tendons and ligaments adapt to stress. Additionally, the tendons and ligaments, which already have a pretty low blood supply, are starting to receive less blood. So altogether, this restricts nutrient delivery, makes adaptation a little bit more difficult, and healing occurs slowly. This is why we're seeing injuries such as Achilles tendons, tears, rotator cuffs, and tennis elbow a little bit more common, more frequently as in an aging population. Finally, I'd like to talk about the loss of bone density that increases as we age. This starts in about the 4th and 5th decade of life and accelerates at a rate of 0.5% per year. This occurs in both sexes. However, after menopause, the rate of bone density loss can increase up to tenfold due to estrogen withdrawal, which triggers bone breakdown. So this is why resistance training is extremely important to bone health. We'll go a little bit more into the biology of aging, focusing on recovery. So as we age, our ability to recover from stressors such as a hard workout, poor sleep, illness, or injury starts to decline. Aging really wears down the repair systems that exist in the body and the ability for the body to regenerate energy. So looking at each of these puzzle pieces, we'll start with mitochondrial dysfunction. A good analogy here would be that the battery just doesn't charge as well as it once did. So every cell has a power plant within it called the mitochondria, which produces ATP, which is the body's energy currency. Recovery is an energy intensive and a process. And when you have aged mitochondria that are making less ATP and producing more exhaust, you can see a decline in your recovery. Additionally, there is a decline in muscle stem cells. And the analogy here is that your repair crew is getting smaller. Muscles have dedicated stem cells which repair and build fibers that are useful after an injury. So therefore, with age and with fewer of these repairing stem cells, the ones that remain are working harder and working less well. The next thing that can happen is increased inflammation. So as we age, we do slowly start to see a constant low level of background inflammation. And this is caused because damaged material is piling up. The aging body runs with a low, steady level of inflammation, which we actually call inflammaging. This is important to differentiate from that acute redness or swelling that you get after an injury. This type of inflammaging or inflammation is actually chronic and causes systemic irritation that actively opposes repair and tips the balance toward tissue breakdown. Next, we'll see hormonal changes as we shift as we start to age. Our body is shifting from hormones that are favoring building to those that are favoring breaking down. And so therefore, the body is geared more towards tearing down rather than building up. And then the final piece here is that there is some vascular stiffening. In this case, there is a slower delivery of supplies that are needed in the body. So repair depends on blood delivery, blood delivering oxygen, nutrients, and signaling molecules to the tissue. With age, arteries stiffen and the endothelium or the vessel lining will start to have a little bit more dysfunction, therefore hindering the ability for those delivery chucks to bring the oxygen, the nutrients, and signaling molecules to tissue. So putting all these pieces together, it is important to understand that they're all interconnected. We have mitochondrial dysfunction, which is creating more exhaust. This drives inflammation and cellular senescence or that vascular stiffening, which worsens the mitochondrial quality. The net result is a system that has less fuel, fewer and slower repair molecules, more inflammation, and a smaller reserve to draw on. So the same workout that you used to do without any issue when you were younger may actually require more recovery time as a result of all of these pieces. The good news here, though, is that all of this is modifiable, which is what we will get into as we talk about the pillars of training for longevity. So how do we support an aging body? So one of the biggest misconceptions is that muscle loss is inevitable with aging. And while some of this decline is expected, much of it is preventable, which we can see in the graph. Resistance training is the most effective intervention across all musculoskeletal tissue. It stimulates muscle protein synthesis, increases bone formation through mechanical loading, and can help improve some of that tendon stiffness that occurs with aging. As we previously reviewed, muscle is a metabolic organ that is important for glucose disposal, insulin sensitivity, and for that collagen turnover, as we discussed before. There are several studies that show that muscular strength predicts all-cause mortality independently of aerobic fitness, and so therefore maintaining muscle mass is certainly important for reducing your risk of mortality. This graph shows us just how the solid lines show us how a body without physical or without strength training may see declines in their strength. And the lines that are dashed show us the improvements that occur and the ability to hold on to muscle strength when there is resistance training. So we don't lose strength because we're getting old. We lose it because we've stopped asking our muscles to perform difficult tasks and stopped it from doing strength training. So what are the ways that we can help our body build that strength? So just some tips here. We want to aim for 2 to 4 sessions a week, 30 to 60 minutes each, that are focusing on strength training. Many will encourage isolated machines to help isolate each muscle growth. But what will give you the biggest bang for your buck is to really focus on compound movement. So this is highly efficient because you are doing one movement that is involving multiple joints with each physical movement. For example, in a squat here, we can see that the hips, knees, and ankles are all involved, as well as all of the surrounding muscle, therefore making this highly functional and highly efficient. Some other examples include deadlifts, lunges, and shoulder presses. Another important element of strength training is power. This is often overlooked, actually. Power is really strength plus speed. And so power is important for us as we age because it can predict the inability of someone to climb stairs, difficulty getting out of a chair, and falls. So therefore, as we age, we want to make sure that we're incorporating some simple power exercises into our routine as well, including medicine ball throws, kettlebell swings, and step-ups. The next pillar of longevity training is aerobic fitness. So this can be measured by your VO2 max, which is starting to become very popular now. A VO2 max is one of the most important measures of cardiorespiratory fitness, and it is the best objective measure for physiological reserve. So what is VO2 max? This is the maximum amount of oxygen your body needs to take in, transport, and use during extensive exercise. VO2 max is not about athletic performance. It is about building a reserve. Additionally, VO2 max is strongly associated with cardiovascular and all-cause mortality risk. In fact, that it is the single strongest predictor of lifespan that we can improve. As we can see from the graph, VO2 max does decline with age. And while we can't stop the age-related decline in VO2 max, we can certainly influence it with the starting point and the maintenance of our VO2 max. So to give you an example, let's say we have two people who are at different points. One person has a VO2 max of 20 milliliters per kilogram per minute, and therefore they can, do all of their normal daily activities comfortably. They have relatively little reserve, but are living life comfortably. Compare this to someone who has a VO2 max of 40 milliliters per kilogram per minute. They can do the same daily activity, but are really requiring much less of their physiological reserve. So for example, walking up a hill requires a certain amount of oxygen. And so that person with a VO2 max of 20 might require about 80% of their capacity, while the person with a VO2 max of 40 walking up the same hill will only require 40. So there is a different physiological stress on the body. And eventually, this will catch up to the person with the lower VO2 max. This also means that daily activities that were once trivial can eventually become a little bit more difficult. If you think about climbing stairs or carrying groceries, these activities, which may seem easy for someone with a VO2 max of 40, may be a little bit more challenging for someone with a VO2 max of 20. So therefore, if your aerobic capacity or your aerobic reserve is low, ordinary life becomes physiologically expensive. But if your reserve is high, you will have more room between comfortable daily life and maximum effort. So this is a very important pillar here. So how do we improve our aerobic fitness and our VO2 max? The first is just to encourage aerobic exercise and increase your aerobic volume. You can do this by walking, jogging, cycling, swimming, or rowing. However, some people like to push themselves a little bit more to understand how to really challenge that VO2 max. So aerobic training zones can be helpful in starting to push yourself into a different level. These zones 1 through 5, are different relative intensities along a continuum. This is not related to speed, but really related to effort and how much your heart is working. So one major way to really improve that VO2 max is to focus on zone 2 exercise or moderate intensity training. This is considered a submaximal training intensity that is really meant to improve your overall metabolism and your endurance. If you think of VO2 max as the engine, the zone 2 is really the training that helps build and maintain the engine's aerobic machinery and efficiency. Many patients have a hard time really keeping track of the heart rate, so the best way to really think about or consider yourself in zone 2 while you're exercising is a talk test. So in this case, a person who's exercising at zone 2 aerobic fit capacity would be able to talk but not able to sing. But zone 2 isn't the only way to improve our VO2 max. Another strategy is to incorporate higher intensity intervals. These are intervals that are performed at sufficiently high intensity that can provide very powerful stimulus and push that VO2 max. So for example, intervals of 4 minutes of pushing yourself with a higher incline on the treadmill and then coming back down for recovery in between can be an excellent way to start to increase your intensity during exercise. So overall, zone 2 is excellent for building your aerobic foundation, but those higher intensity exercises are generally more effective for improving your VO2 max per unit of training time. So zone 2 is building the foundation and higher intensity is really raising the ceiling. And for longevity training, we say that you need both. The next pillar of longevity training is mobility. And so many people think that mobility means just stretching, but really it's a combination of these three things: flexibility, strength, and motor control. We don't simply want more motion, but we want to make sure that that motion is controlled. And so this is important when we think about the strength and the cardiovascular fitness that we just covered in pillars 1 and 2. Those are only helpful if you can move your body through different ranges of motion required to use them. So in other words, this mobility pillar allows strength to become functional. If you think about a person with excellent leg strength but poor ankle mobility, they may have some difficulty squatting, getting up off the floor, or climbing stairs. So that's why strength is what really gives you the force, and mobility gives you the ability to position yourself in different motions to use that force. Unfortunately, mobility also declines with age and is accelerated by less movement, tendon stiffness, arthritis, muscle shortening, and some previous injuries. Some areas that are greatly impacted include the thoracic spine, hips, ankles, and shoulders. For example, when there is a loss in the thoracic spine, we may start to feel a little bit of neck pain, some shoulder impingement, and you maybe even see a poor golf swing. Additionally, mobility preserves independence. As I had mentioned before, mobility is what helps us determine, can you get off the floor? Can you get up? Can you, once you've fallen down, can you reach overhead? Can you rotate your torso? And can you put on your socks? Those are all mobility tasks, and they are directly related to your independence. So as we age, it's important to preserve our range, our control, our strength, and power. You don't want to be someone who's reaching the age of 75, for example, and can't get back up after they're on the floor. You want to make sure that you're maintaining your movement capabilities throughout adulthood. So in summary, mobility is really your movement insurance policy. It preserves the range of motion and movement options that allow you to remain active, independent, and adaptable as you age. Mobility is not about maintaining enough range of motion, control, strength. Mobility is about maintaining enough range of motion, control, and strength to make sure that you're performing the movements of daily life. So what are ways that we can improve our mobility? Here are a few stretches that can be helpful. The world's greatest stretch with thoracic rotations are really targeting the thoracic spine and the hips. Some hip airplanes and deep squats all together can help with establishing mobility. We've asked you to do a lot of exercise with some strength training and then adding in some aerobic fitness. But adding these type of mobility exercises in for about 5 to 10 minutes a day can really help you build your reserve. So the biggest takeaway from this pillar should really be that to strength train through a useful range of motion. Our next pillar is on balance and neuromuscular control. So balance surprisingly begins to decline at around age 40. However, most people don't really notice this until they've had a trip and fall. Therefore, it shows us the importance of building a functional reserve across the lifespan. And so that is what is depicted in this illustration. We want to make sure that we have as much physical capacity as possible at an early age, and we want to make sure that we're preserving it through life. So this diagram helps us understand that a little bit more. The x-axis represents time, and as we go through age from early life, adult life, and older life, we can see the changes that really occur. The y-axis represents our balance and strength. And so this is really our physical capacity. There is this yellow band here, which is labeled disability threshold. And this is the most important part of the whole figure. That yellow region represents a threshold below which physical capacity becomes insufficient for normal functional demands. So as strength and balance begin to fall below this threshold, the risk of having difficulty with activities of daily living, with falls, loss of independence, and the need for caregiving all increase. Importantly, disability threshold isn't the same for everyone. A person's functional demands can really be impacted by their environment, their health, their support system, and all of these influence declining capacity, which can really become clinically meaningful as we start to age. So here the graph has two different lines that show two different trajectories of physical capacity. The green line shows a rise in rapid early life. We reach our peak in that adult life period, and then towards older life, we can see that the green line starts to decline. What is notable here is that that green line is remaining above that disability threshold. The difference, though, is highlighted by the blue curve. In this case, this patient was preserving their reserve and through early life, peaked at a lower level in adult life, and then began to decline, and then eventually crossed the disability threshold sooner. So it's important to understand the many stressors that can really contribute to disability. And I've listed a few of them below here. Some stressors or transition that can accelerate functional decline or expose underlying lack of reserve include pregnancy and menopause. So pregnancy really creates a substantial physiologic and biologic demand on the body. It can temporarily affect musculoskeletal function, the pelvic floor balance and cardiovascular demands, as well as body composition. The important message here is that pregnancy doesn't cause long-term disability, but it is a major physiological transition that can change the trajectory of physical capacity. Menopause is another transition that is associated with changes in body composition, muscle mass, bone density, and cardiometabolic risk. This highlights the importance of resistance training, aerobic fitness, making sure you're getting adequate protein, and bone loading activities. As we progress into our later years, we can see, though not biologic, retirement can also reduce your ability to both your strength and your balance. Someone who previously used to walk to work or take the stairs or walk in between meetings may suddenly lose those behaviors and bring us back to that sedentary lifestyle that we had talked about. And then we'll just quickly go through caregiving duties. When you start to care for others, for aging parents, spouses, or grandchildren, we may lose that ability to really focus on recovery, which is a big topic we'll get to. This includes exercise, sleep, and nutrition. Falls are another major event just because they do create this vicious cycle of fall and then having a fear of falling, so therefore doing less activity. As a result, you lose more balance and strength and actually increase your fall risk. So we tend to think about exercise as something we do to prevent disease, but another way to think about fitness is for building that reserve. Strength, aerobic capacity, balance, and muscle mass are all deposits. And then aging, illness, injury, and periods of activity are considered withdrawals. So therefore, the more reserve you build, the more withdrawals you'll be able to withstand. So some simple exercises that we can do to build balance and neuromuscular control include single leg stance, farmer's carries and Tai Chi, as well as lateral stepping, walking on uneven surfaces, and doing some eyes closed progressions. The fifth pillar of longevity is recovery, and this is not last because it is what you do after training, but it is a very important pillar to consider because it does produce adaptation. So training provides that stimulus, recovery allows the body to respond to the stimulus, and adaptation, which is the main result, is when you actually really get stronger. So without adequate recovery, you're repeatedly applying stress without giving the body enough opportunity to rebuild. So this diagram shows us just how everything works out here. The dashed horizontal line represents a baseline performance. And as we can see, there is a training stimulus, which causes some fatigue. That causes the green line to drop down. As we recover from that fatigue and reach that baseline status, we are ready to work out again, but making sure there is adequate recovery is what gives adaptation. And that is the area that we would like to maintain. When you have a loss of adaptation, you have kind of undone all the good benefits of exercise, and so we want to try to avoid this. So it's important to see recovery as not something that is not what you're doing when you're not exercising. It's important to consider it as part of your training program. Recovery is really a very natural final pillar because it helps bring all the other four pillars together in that it shows us that strength provides a stimulus, aerobic training builds that engine, mobility preserves movement options, balance preserves the control, and then recovery allows all four of these to finally reach adaptation. So now that we've talked about the importance of recovery and its impact and how it's impacted by aging, I just want to give a few tips on how we can improve recovery. So recovery becomes a little bit more important as we age. It doesn't mean that adults shouldn't train harder. It just means that there is a smaller margin of error. So as we reviewed already, with aging, there are changes in muscle protein synthesis and tendon and connective tissue remodeling and cardiovascular reserve. Additionally, life can get in the way here too. It does add additional stressors such as work, family, travel, poor sleep, and psychological stress. So all of these add stress load. So here we have a bucket that represents our recovery capacity. It is essentially a total stress bucket where we have all of these different stressors going into the bucket. When that bucket is unfortunately too full and there is an overflow, we can start to see things such as injury, burnout, illness, and poor performance. So that's why we want to make sure that there is a balance here, and we'll talk about how we can maintain that balance. So it's just important to remember that training isn't something that we prescribe, but it really needs to be something that is considered in the context of a patient's entire life. So what are the things that we can do to optimize recovery? There are four components that have the strongest evidence for recovery, as they allowed for broad physiologic recovery, adaptation, tissue repair and glycogen restoration, and prevent excessive fatigue. So sleep is probably one of the most important recovery behaviors, as it supports neuromuscular recovery, hormonal regulation, immune function, and tissue repair. Nutrition is another big topic. It provides a substrate for adaptation, and it is particularly important to ensure that we're getting adequate calories, protein, and carbs here. Progressive training is another alternative. When you're alternating hard and easier workout sessions, you're preventing an accumulation of fatigue. And then hydration is also important to restore the fluid and electrolytes that we've lost after a heavy exercise. Some other keys to recovery include active recovery. Low intensity movement can certainly be useful after hard training. Some examples of these include easy walking, light walking, sorry, some easy cycling, mobility work, light swimming, and some yoga. This is certainly better than laying on the couch all day and resting. And the goal here is to provide a level of activity that facilitates recovery without adding substantial additional stress. This has pretty strong evidence for subjective recovery as well as reducing perceived soreness. However, it may not always be the best option here as it doesn't allow the body to fully recover. So this would be useful for someone who is an athlete or competing in a tournament. Massage is another good recovery method. This will help increase blood flow, reduce muscle tone, and modulation of pain signaling. And it does also provide some psychological reaction. The important distinction here is that massage may make you feel better before it allows you to physiologically recover. So we want to think of massage as useful for soreness and relaxation, but it's more of an adjunct rather than a substitute for the other recovery methods we had mentioned before, such as sleep and nutrition. Sauna is a very popular recovery tool. This is where you are exposed to heat, which increases the core temperature. This results in an increase in heart rate, blood flow to the skin, and heat acclimation adaptations. This is very helpful for relaxation and perceived recovery, as well as for muscle soreness. Cold plunge is another wonderful option. This does cause peripheral vasoconstriction, which reduces tissue blood flow and changes pain signaling. As a result, this can really reduce the perception of soreness. And then finally, compression garments can be useful. They do put a little bit of external pressure on the limbs. This helps with venous return and decreases any kind of fluid accumulation or edema. Many people have found this to be helpful in reducing perceived soreness and perceived recovery, though you may need to give a little bit more time for the body to completely recover here. So compression may modestly improve soreness and perceived recovery, especially after endurance exercises, but not completely essential for recovery, and that the other methods are a little bit stronger. A lot of people like to compare cold plunge and sauna, so I just want to give a little bit more information here. Cold plunge is excellent after things like races, competitions, or tournaments. However, it is important for you to know that using cold plunge immediately after any kind of strength training exercise may actually blunt the building of muscle. However, cold plunge is good for cardiovascular health. It does show reductions in blood pressure and has been very good for recovery and mood. So we just want to make you aware of that cold plunge paradox, that we want to avoid cold plunge immediately after exercise if the goal is for you to build muscle mass. Sauna also offers some very strong evidence for long-term cardiovascular and systemic health. And so I just wanted to make sure that patients were aware of the two differences between the two. Sauna can also help with chronic muscle and joint pain, can provide some respiratory comfort, stress reduction and relaxation, and really improve overall quality of life. So these are two very good methods that will help support recovery. Next, we'll talk about exercise through the decades. And so this is not rigid, but hopefully something that'll help keep you kind of focused in each decade that you're in. So for those who are in their 20s, this is the part when we really want to make sure that you are building your physical capacity, focusing on strength, aerobic exercise, and movement. Your mindset here should be, let's build the engine. In your 30s, the goal is really to build and maintain. This is when life starts to have some competing interest with training, career, relationships, children, travel, long work days are all really things that kind of get in the way of exercise. So the biggest priority here is consistency, trying to get those 2 to 4 strength sessions in a week and targeting 150 to 300 minutes of aerobic activity. We want to make sure that you're protecting your sleep and recovery here too, though of course easier said than done. For those in their 40s, the goal is really to maintain and optimize. While you still might feel extremely capable, recovery starts to matter a little bit more here. You might start to notice that you're experiencing soreness a little bit longer, that you're having more recurrent injuries and less tolerance of sudden changes in training activity. So priorities here should be really focusing on strength and aerobic fitness, and those are absolute non-negotiables. We want to make sure you're getting power exercises in, as well as maintaining mobility and remembering the importance of recovery. Again, quality over quantity at this point. As we reach our 50s, we want to preserve what we've built. This is an extremely important decade. And this is really when we had talked about before, when many people start to lose muscle mass, strength, bone density, and aerobic capacity. So we really want to make sure that patients are focusing on those strength and power building exercises. As we get into our 60s, we want to protect function. So at this point, we're no longer focusing on trying to reach, your personal record on a bench press or achieving your fastest 5K. As a bare minimum, we want to make sure that you are preserving your ability to do things. So can you carry luggage? Can you climb the stairs? Can you play with your grandchildren? The priorities at this decade would be really focusing on strength, power, balance, and aerobic capacity, as well as mobility. So this is when all 5 pillars really kick in. And then finally, for 70s and beyond, we want to make sure that you're training for your independence. This is perhaps the most powerful message, is that we want to make sure that you are still able to move. Can you get out of a chair? Can you quickly react to something that might be falling? Can you maintain your muscle center of mass? And so that's where strength, power, balance, and aerobic fitness, as well as mobility, become very important. And so in the home stretch here, I just want to talk about injuries and injury prevention. Some risk factors for injuries include just not focusing on your recovery capacity. So lack of rest, poor sleep, and poor nutrition and hydration can greatly increase your risk for injury. Other risk factors for injury include ignoring pain, previous injury, or rapidly increasing your volume of exercise. We have weekend warrior syndrome written here, where you're too busy in the week, so you do as much as you can during the weekend, which is an excellent way to get exercise. But if you're going too hard, you do increase your risk of having an injury. So just want to caution there. So how do we avoid injury and reduce our risk of injury? The first is to build capacity. This is probably the most important principle. If you want to run a marathon, play tennis, ski, hike, play pickleball, all of those types of things, we want to make sure that you are progressively preparing the tissues for those demands. So this is where resistance training helps prepare the muscles, progressive loading helps prepare the tendons, and weight-bearing exercises and resistance exercise help build bone density. Your capacity should never exceed your demand here. The next tip would be to progress gradually. So one of the biggest injury risks isn't really the exercise itself, it's doing too much too soon. So this kind of goes back to that weekend warrior syndrome. So some examples for running, for example, if you were doing 5 miles per week and suddenly increase to 25 miles per week, you do increase your risk of injury. The next recommendation to avoid injury and to reduce your risk would be to strength train. And I know we've discussed this a few times now, but strength training is one of your best injury prevention tools, as it helps build your muscle capacity and your tendon capacity, builds your bone density and your joint stability, and provides a little bit more neuromuscular control. So you don't want to just train for the activity, you want to make sure that you're training the body to perform the full activity. So when you're playing tennis, you're not just playing tennis, you are engaging the leg strength, rotational strength, shoulder strength, power, and balance. And so therefore, you really need to make sure we're training all aspects to be ready for activity. Next, we just want to talk about training the brakes, not just the engine. I think far too often people want to make sure they can do an activity, but they forget about deceleration. And this is when a lot of injuries can occur. For example, you want to make sure you can land from a jump or stop from running and be able to change directions. Pivoting when skiing, for example, or descending stairs are all really important um, uh, ways to train those brakes to make sure that you are not increasing your risk of injury. You don't want to forget mobility. I know it was one of our main pillars, but we want to make sure that you are flexible enough to move and you have sufficient mobility for the activity that you're doing. For example, running will require adequate ankle and hip mobility. Going back to the tennis, making sure there's hip, thoracic, spine, and shoulder rotation. Just like with golf, we want to make sure we have enough hip and thoracic rotation. So mobility is extremely important to help reduce your risk of injury. And then finally, we've talked about this many times too, but the importance of recovery. This is where that fifth pillar really comes back. And if you've repeatedly trained before you're recovering, you can increase your risk of injury. You have fatigue that's accumulating, which can lead to movement quality deterioration. That training load then becomes too hard, and then your performance can decrease, increasing your risk of injury. So just some warning signs to look for to make sure that you're not injuring yourself. If there is a loss of function, sharp or localized pain, altered gait, pain that is progressive and worsens during exercise, persistent swelling, especially when it is related to activity, pain that worsens between sessions, or recurrent pain in the same location. These are all moments when you should reach out to your doctor to make sure that you're not causing more damage and ignoring those persistent and escalating pain signals. So in conclusion, the goal isn't to maximize your workout today, but to really maximize the number of years that you can continue to do the activities that you love. Every workout is an investment in the next decade, not just the next race. So I'm hoping that these tips have been helpful to the whole group. So thank you very much for listening.
Great. Thank you so much, Dr. Akyar, for that informative presentation. We will now move into the Q&A portion of our health hour. So if you have a question, you can submit it anonymously using the Q&A feature at any time. We've already received some great questions, so let's start with our first one. Dr. Akyar, what are your thoughts on the potential role of hormone replacement therapy in fitness for both women and men?
That's an excellent question. Hormone replacement therapy is certainly becoming a hot topic these days. I want to start off with saying that hormone replacement therapy is great for the populations who need it, for those who have diagnosed hypogonadism, and for those who are experiencing menopausal symptoms. By treating both those in men and women, we want to make sure that we are supporting the recovery of each individual. And so that will then ultimately support exercise. So I wouldn't turn to hormone replacement therapy directly as a method to help with your fitness. We would look at it to help kind of address the symptoms that are preventing you from getting into the gym or into a regular routine.
Thank you. That's really helpful. Here's another question from the audience. For women in their 60s, what is the recommended strength training frequency for a full body workout?
So this is a great question. I am going to turn back to this slide. Of training through the decades. So important here, in the 60s, we want to protect our function. This is where, we are not trying to reach that best 5K or hitting a personal record with bench pressing, as I had mentioned before, but we really want to make sure that you are preserving your function to make sure that you are able to do certain activities as you age. So to answer the question, making sure that you're having about 2 to 3 strength training sessions in the week. They can be separated by 1 or 2 days, but I would really encourage full body exercises each time you're doing a strength training session.
That's great. We have another question here. So you recommended compression as a recovery tool. Is that simply wearing compression socks or wraps, or should people be using inflatable compression sleeves like Normatec boots?
So it's a great question. The Normatec boots have been extremely helpful to many different patients, especially those who are involved in running. You can use all three sleeves or the boots are really just fine. But we want to just make sure that you're not doing too much compression where you're starting to cause pain, making sure that you're gradually increasing that with the Normatec boots so that you're at a level that is providing comfort and some good recovery.
Great. We have another great question here. So, for somebody who has mobility issues, what are some ways that they can increase their VO2 max?
So that's a great question. This is something that we had listed a few examples. VO2 max is not just running or walking fast. There are a few things that you can do, such as getting in a pool. This will take that weight off of you and allow you to really get some good exercise in. So if you have access to a pool, this would be a great way for you to make sure that you're increasing your VO2 max and maybe actually help you build some strength as well.
Great. Here's another question. So, what are your thoughts on supplements for aging endurance athletes?
Great question. Supplements are another hot topic. I'd say my two favorite for longevity training would be protein and creatine. Making sure that you're getting enough protein. This goes back to that recovery pillar where we're looking at nutrition, sleep, hydration, all important parts. But you can really kind of amplify your recovery by adding protein if you're not able to ingest enough on your own. This will really help support muscles. Similarly, creatine is a great addition to your workout if, as long as you don't have any kind of kidney disease or any other contraindication to taking it. Doing 3 to 5 grams per day with the resistance training can help support muscle growth. You just want to make sure that you are aware of the side effects that can come with this and make sure you're talking to your doctor before getting started.
Wonderful. Kind of going off of that question, we did have another specific question regarding your thoughts on collagen.
Collagen is good, not as strong evidence as we can see with protein and creatine. And so therefore, if it's helping you and not providing any side effects, a lot of people will have some GI intolerance, then it is something to consider. It's just the evidence isn't as strong as the other two supplements.
Great. Kind of going off of the supplement topic here. You mentioned creatine, so we have a question about should everyone take creatine?
So another great question. I want to caution patients here. Sometimes creatine is not for everyone. As I had mentioned before, patients who have some kidney disease this may not be a suitable supplement for them. We want to make sure that you're using creatine to help support muscle recovery and muscle mass. So if you're not someone who's exercising and doing strength training daily, then you may not benefit as much as someone who is. I do want to note here that there are some GI side effects that are associated with the use of creatine, such as abdominal bloating, and some discomfort with distension. And so that's why I just want to make sure that that is something that you review with your physician, but certainly a very good supplement to consider for supporting muscles.
Thank you. I know you talked a little bit about, incorporating zone two and also, strength training. What are your recommendations for, what does an ideal schedule look like in terms of the sequence of those activities?
Great question. I know we've asked a lot of you to try to get 150 minutes to 300 minutes of good cardio, as well as anywhere from 2 to 4 sessions of strength training in a week. Um, Hard to give an exact response to this. This will really vary for everyone, dependent on their ability level, dependent on how much time they have. I would say the two most helpful things you can do is making sure that you have some consistent cardio and some strength training. So however that can fit into your schedule, ideally you could considering alternating days between cardio and strength training will give your muscles the time they need to recover while also allowing you to achieve your cardiovascular goals.
Great. So I know that we've talked a lot about recovery, and some of the methods that people can use to enhance their recovery. So we have a question here about, can IV therapy assist with a quicker recovery after intense workouts?
So the research here is not as strong as the methods that I had presented before. If your goal is hydration, then you can get a little bit more hydration and restoration of your electrolytes faster by doing IV hydration. However, it is something that you can achieve too through proper hydration. Based on the science and the research, it doesn't show as strongly as it would if you were to just ingest water or any electrolytes.
Thank you. Kind of going off of the recovery topic here, we do have a question about nutrition. And so somebody is wondering about how the timing of nutrition plays into recovery. And what are your recommendations in terms of, timing when you're eating, with recovery?
Great question. It is important to be ready before you go into activity, as important as it is when you come out of one. So making sure you have enough fuel about 30 minutes before you go into an activity will give you the strength you need to do that full training session. And then once you're finished, making sure you're restoring with some protein-rich foods can be, immediately after exercise or half an hour later is totally fine, but we want to just make sure that you are fueling both before and after exercise to make sure that you're completely supported nutritionally.
Great. We have a question here about asking if older adults should still be lifting heavy.
Great question. Yes, it is important for older adults to lift heavy. I would say the one important point here is to make sure that you are not exceeding what you're able to. As we had talked about in the presentation, progressive increases will in muscle, or sorry, in weightlifting can be very helpful. We want you to build your reserve in those 20s, 30s, 40s, 50s. But as we get into 60s and 70s, maintaining strength is equally as important. So as long as you are able to lift heavy and or work your way up to it, this is something that is encouraged.
Wonderful. We have a question here about electrolytes. I know you just mentioned that, hydration and electrolytes are very important. However, we do see, a rising popularity with these electrolyte packets. And so we have a question about how often we should really be consuming those.
Great question. There is a very wide variety of what is contained in those electrolyte packets. Some of them will have a lot of salt in them. And so people who do have some cardiovascular risks, such as high blood pressure, should be careful in adding too much salt into an exercise routine. I would say water is your, best substrate here, and sometimes you really don't need those extra electrolytes. If you're someone who is training very heavy, and running or doing a lot of cardiorespiratory fitness throughout the week. Sometimes there can be benefits to those, but oftentimes those packets, you just want to be careful with what you're adding into your diet and making sure that you're not adding too much salt. That's usually the biggest culprit in the electrolyte packets.
Great. So I know that you mentioned, mobility and that stretching and the importance of that. So we do have a question about whether stretching right before exercise is really beneficial.
Great question. As we get older, I did say that the tendons and the ligaments are also losing their elasticity. So stretching is important, but before exercise, research actually shows it's better to do more dynamic activities, a little bit of light jogging. This is all something that helps warm up the body. Static stretching is something that would be recommended after exercise, once the body is warm and loosened up. There are some hypotheses that doing static stretching right before exercise can actually do a little bit of harm, and that you may not be able to lift as heavy or as efficiently as you could, or it may even injure yourself when you're stretching. I don't know if that's a little bit too strong to say that there could be injury, but it is certainly something to consider. If stretching before exercise helps you warm up, fine, but I would say you'll get a better response if you do a little bit more dynamic warm up and save the static stretching for after exercise.
Very helpful. Before we wrap up, we do have time for one final question. So the question we have is, should I still exercise even if I'm sore?
Great question. Soreness is expected after exercise. We just want to make sure that you are not exercising beyond pain. So if you have sharp pain, pain that is actually increasing as you are getting farther away from your workout, that's a warning sign where we really want you to consider seeing a medical professional before doing a little bit more exercise. So some muscle soreness is good. It tells you that the body is breaking down and rebuilding that muscle, as we had talked about before. But working through pain, working through swelling, those are all things that can really increase your risk for injury. So you want to make sure you're being careful there.
Great. Thank you, Dr. Akyar, for sharing your expertise with us today. And thank you to everyone who joined the session. If you'd like to revisit anything from today's discussion, please keep an eye out for an email as we will be sending out the recording. Thank you again for being here, and we hope you'll join us for Shift's next Health Hour.